Our next speaker is a graduate of University of Santo Tomas College of Medicine and is currently an associate professor of the Department of Medicine and Faculty of Medicine and Surgery at the same institution. He is a fellow of Philippine College of Physicians and a past president and fellow of the Philippine College of Chest Physicians and Philippine Society of Sleep Medicine. Let us now welcome our next speaker, Dr. Patrick Gerald L. Moral.
Good day, everyone. It's my honor and privilege to be invited as a guest speaker for the Philippine Urological Association Mindanao Chapter Postgraduate course. I've been asked to speak to you today about how to apply ethical principles in the practice of telemedicine. I don't know how many of you have been doing teleconsults, but I've been doing this over the past 15 months. And it's been a challenge, but it's also been a privilege to be able to offer this to our patients during the time of a pandemic. It may have been more common here in the NCR or the National Capital Region, but we do have a lot of colleagues who still do not want to make use of telemedicine. And perhaps, understandably, there are issues that we have to consider. In the next few minutes, allow me to discuss to you telemedicine and the accompanying ethical issues that we have to answer. And I do hope I will have some time at the end to be able to answer some of your queries. But just in case that is not available, you may message me and your questions over Twitter at Eric Moral. For any disclosures, I do not have any conflicts of interest for this part of the discussion, right? So let me start off with a sample case. You have a patient here who is a 50-year-old who presents with dysuria for the past 2 weeks. The patient has also noticed decrease in urinary stream, and the patient claims to have a urethral discharge but denies any recent sexual activity. The patient contacts you via mobile and asks you to prescribe an antimicrobial. In the normal or usual setting, we would ask this patient probably to go to the clinic so we can do adequate history taking, an actual physical examination, probably do also a digital rectal examination on this patient to check on his status of his prostate, and then afterwards do some specific lab requests and then give him appropriate treatments or prescriptions. However, can we make use of telemedicine and to handle this particular issue? Remember that teleconsults are actually a part of telemedicine, which is a term that is more encompassing, which means it is a practice of medicine, whether it's in terms of consultations, health education, interaction between patients and doctors over telecommunications or via technology. Can we actually get an adequate history and the physical examination via a teleconsult? And is it safe enough to prescribe medications and request for diagnostics? So we will try to see whether these are applicable, and we will try to ask some questions that hopefully we can answer. There are certain expectations when we talk about teleconsultations or telemedicine. As I've said earlier, it is a practice of medicine over a distance. Now, it's not simply making a diagnosis over the internet or over technology, but it's also deciding on interventions, therapeutic decisions, and of course, making subsequent therapeutic recommendations. And we base this on data that is forwarded to us or given to us by the patient, or including documents or any other information that is transmitted via the telecommunication system. Now, there are certain challenges that we face in that. Are the standards of practice via telemedicine different, or are they similar to what we do in the real clinical setting or the face-to-face setting? And in terms of the information that we get, is it really enough, or is it sufficient for us to be able to propose diagnostic and therapeutic options to our patients? Remember that we may be hampered in the physical examination, as we will be describing in the course of the discussion. Now, another expectation is that basically this is not something that occurs just between a patient and a physician, but this can also occur between two physicians, just like a referral. So patients information may be discussed over the internet, and they can be learning that can occur between two health professionals. But the challenge here is that, are we sure that we are observing the duties of care online that we should be observing for patients in the practice of telemedicine? Now, another expectation is that This is basically done for patients who cannot see a physician timeously because of many reasons like inaccessibility due to distance. An example also will be during the quarantine where patients were not allowed to go out of their homes. This may be due to physical disability. Employment may prevent them from taking time off from work. Family commitments, including caring for patients and others, patients' cost, as well as physician schedules. The question that I think will be that has to be answered or that begs to be answered is that is this an adequate replacement for face-to-face consultations? Now, probably this is one of the challenges that is very significant in terms of the Philippine setting, is that it has the ability to democratize healthcare. That means patients in the most remote areas of the Philippines, as long as there is access to the internet or via technology, can actually now secure healthcare, whether it's primary healthcare or specialist care, because of telehealth or teleconsultations. And this has really the potential of improving healthcare. But as we know, technology has its attendant costs. So, are the patients with limited access here given equal opportunities to utilize telemedicine? And this is where we speak of justice. Now, let's differentiate between medical ethics and the ethics of care. And I'd like to emphasize that when we talk about telemedicine, we'll focus on ethics of care. So generally, if you've heard me lecture on ethics before, it focuses on the universalizability of ethical choices and abstractions of particular patients and situations. So it focuses on that. Compared to ethics of care, which talks about the uniqueness of every human being and the particularity of their own situation. So each situation is going to be unique and we cannot box them into one specific category. So just to summarize also for medical ethics, it focuses on freedom, and we talk here about autonomy. It's focused on the patient. It focuses on cure, fighting disease, as well as vulnerability. And it approaches human beings as independent individuals. While on ethics of care, it talks about relations. That means there is a dependence, and relationships may be asymmetrical. Despite our attempts to make relationship equal, there will always be that imbalance in that there is always that view that the physician is held higher compared to that of the patient. So we must be aware of that. And we have to understand that human beings per se are vulnerable, especially patients. And it is important at the end of the day that these interpersonal relationships need to flourish because we are basically relational beings. So we will focus on how we apply that in telemedicine. Now, what we'll do is I'll give you some questions, and I'll give you probably a few seconds to ponder and think whether the answer to this question is yes or no. And hopefully this will allow you to have a better understanding of whether telemedicine is something you can make use of in your practice. So my first question is, should all physicians know about telemedicine? Yes or no? So think about it. All right. So if we look at our PMA Code of Ethics, it says here that a physician should be dedicated to provide competent medical care with professional skill, full professional skill at that, in accordance with the current standards of care, compassion, independence, and respect for human dignity. So what do we want to focus on here? That means our professional skill is practiced in accordance with current standards of care. And during the pandemic, we knew that patients were sidelined by the COVID cases, and these patients needed to be seen, especially our chronic patients. So part of the current standard of care means to be able to deliver health services, and that is part of that will be telemedicine. So should we know about telemedicine? Then the answer here would be yes, because as we said, it must be in accordance with current standards of care. And part of the promise to be professionals, when you say promise, it means a promise to acquire it and maintain and advance. One is an ethical value system. And here is where telemedicine comes in, knowledge and technical skills, as well as interpersonal skills. Now, just to differentiate, how do we make sure that we are digital professionals? Because I'm sure all of you are listening to me via the internet right now. So basically, you are engaging in some form of digital telemedicine, where you're educating yourself via technology. So we have to be digital professionals. And what should we do? So we would at least want to make sure that we talk about our proficiency, our reputation, as well as our responsibility. So for proficiency, we have to make sure that we maintain an appropriate competence in selecting the technology. So we have to know how to use the technology, but we have to be mindful of the security, including the possibility of a lack of privacy and confidentiality by this technology. We have to make sure that we maintain our appropriate online professional presence and guard any digital attacks and behave online as professionally as we would do in real life. Sometimes there is a tendency to be disinhibited online because there is no actual patient or face that we see in front of us. The responsibility is we have to model positive behavior and maintain appropriate professional boundaries when communicating with our patients. And I'll show you one example where that becomes a challenge. We have to make sure that we don't waste the resources of our patients and ourselves online by not being prepared, and be careful in terms of safeguarding data. And we have to be careful about making public anything that we would not be comfortable with. And we should never forget that what happens online stays online potentially forever. And we must never engage in any illegal or inappropriate behavior in any digital medium or behave in a way that is considered as reckless or ill mannered. All right. So this was a study in India, and they tried to identify some of the issues that could be identified with telemedicine. It was divided into clinical, administrative, and technical. So their question was that would the care provided here be less than ideal because of possible misinformation? Now, can we practice across borders? So can I see patients in Mindanao, and can a doctor in Mindanao see patients in the NCR? Now, in terms of the provision of care, do we have to receive special training to do telemedicine? Now, we also have to have the availability of emergency support, and we'll focus about that when we talk about off-hours resources. There's a bias towards the best connected demographic, so maybe older patients or those who are underprivileged may not have access to telehealth, and we have to make sure that whatever we use in terms of monitoring can be used by everyone. Now, other issues that are involved here is that we have to make sure that the devices we use are interoperable. That means it is accessible by most of our patients and that our patients accept this technology. Now, I would want to focus on personnel in that the challenge here is there may be a loss of interpersonal relationships, and there may be a loss of respect of timelines, like boundaries may be blurred, like calls for help on a 24 hours, 7 days a week basis. And of course, reimbursement will always be one of the questions. How do we handle reimbursements, or can we be paid for our teleconsults? So as we mentioned, if we look again at our PMA Code of Ethics, Section 3 dictates that physicians shall be committed to lifelong learning, and our goal is to be able to provide care that is holistic, competent, and compassionate, while at the same time making sure that we uphold the highest professional and ethical standards and respect human dignity. So part of knowing about telemedicine is part of lifelong learning. So we have to know about telemedicine. And our goal here is to improve the quality of care that is rendered to our patients. And of course, at the end of the day, we have to make sure that one of our goals is to improve access to care by most of the Filipinos, if not all of the Filipinos. And we must contribute to it by, as we said, by giving patients access to equitable healthcare. And this is probably one of the biggest advantages that telemedicine can offer. So again, should we know about telemedicine? The answer there is a resounding yes. But let's now go back to our case. So this patient, we're not sure, is it UTI, is it a prostate problem? So they're requesting you to see a patient via teleconsult. If you actually answer this patient via the phone consultation, via voice or text, this is actually a form already of teleconsultation. But for our purposes, we'll talk about here probably a video consult via via technology. So the question here is, must you see this patient via teleconsult? So what is your answer? Yes or no? All right, so I've given you a few seconds to think. So the answer to this question is no. So if you cannot, going back to the section 1 of the PMA Code of Ethics, if you don't think that you can provide competent medical care in accordance with what we mentioned earlier via telemedicine, then we must not employ a teleconsult. Because remember, our goal here is to provide competent medical care. And when we talk about competence, what does that mean? It means the ability to perform a specific task in a manner that makes sure that the outcomes are desirable. And We have to have the ability to apply knowledge, skills, and abilities to new situations as well as to familiar tasks for which prescribed standard exists. So as we mentioned here, we're basically transferring our outpatient consultation, which is something familiar to us, into a new situation, which we do via technology. Now, if we do not have the ability to apply knowledge, skills, and abilities here, then we do not have the competence to do so, because that task should help us yield a desirable outcome, which means come up with a diagnosis and hopefully give the patient the appropriate treatment. So competence has to be developed before we involve ourselves in telemedicine. And this is a nice description in terms of what are the determinants of healthcare providers' performance according to specific standards. There are social factors, that means there are expectations from us by the community, our peers, as well as our patients. And there are social values, that the doctor is someone who is there to be able to provide healthcare at all times to patients. And then we talk here also about organizational factors, which means we talk about now what are available. And this will be where we may have some challenges because we don't have any training yet, supervision, what will be the mechanisms by which we do these tasks, and what will be clarity in terms of responsibilities and goals here. And then, of course, when we practice, there is always a provider motivation. And what does that mean? We have expectations of ourselves and what we want to do in our practice. Talk about self-efficacy. There are individual goals as well as some readiness to change. So that will be important if we do decide to embark on telemedicine. And what will be the competencies? We've talked about your knowledge, skills, abilities, and of course, traits are important. These are our values and virtues that are inculcated in us. Now, the provider behavior will be how do we perform according to specific standards. There must be an assessment that we are able to do. However, this is a challenge in telemedicine. Can we do really a complete assessment? Can we give a correct diagnosis? And can we make appropriate referrals for counseling and treatment? And our goal here, of course, is to have positive results in terms of health outcome and patient satisfaction. So these things we have to look at if we do plan to embark on telemedicine or teleconsultation. So it's been mentioned here too that, remember, part of our rights as physicians will be we have the freedom to decide and choose whom we will serve, except in cases of emergencies. So telemedicine is something that we do not employ in terms of emergent cases. So we do have the freedom to decide whether we want to make use of telemedicine or not. So we are not mandated to see this patient because it is not an emergent case. And as we said, we can only attend to patients within the limits of our capabilities. If we do think we cannot attend to this patient and give the patient the best care possible, which is in line with beneficence and non-maleficence, then by all means, you can refuse to see this patient via teleconsult. Now, this is one of the challenges that we've mentioned in telemedicine, in that it can potentially infringe on the physician privacy due to a 24/7 virtual availability. I'm sure that happens sometimes when you provide your patients with your cell phone number. There may be a few patients who may actually disregard that it is outside your office hours. So this is one of the challenges of teleconsultations, which means patients have to be aware that there's a time limitation or wherein they can access the service and the physician himself or herself. That's why we need to inform the patient of this and inform them of what we call off-hours resources. That means if we are not contactable, like in my case, I only do teleconsults between 12 to 3, and I respond to queries only until 5 p.m. Anytime after that, and if there is something important or they feel that the patient needs medical attention, I give them either the number of the emergency room or I tell them to proceed to the nearest healthcare facility where they can actually receive a face-to-face consultation. So this is the part of our responsibilities too, in terms of informing our patients. Okay, let's now go to the next question. How will patients know that you're practicing telemedicine? Unless one, they call your clinic and talk to your secretary, and secretary tells you that you're doing telemedicine, which I've been doing for the past, as I said, 15 months, and I've not had any face-to-face consults. Can we advertise? Especially now, you see this on social media. Can we advertise our teleconsult service over social media? Is it part of the things that is considered ethical? So again, we look at our local guidelines, and the PMA Code of Ethics says that we can actually promote the practice of the medical profession because our patients will not know it unless we have information. However, what is allowed to be contained in terms of your internet postings, which will be only the name, your specialty, your office hours, and your hospital affiliation. So contact numbers also, of course, may be included so that they can actually consult you. So this is an example of how I can be consulted by my patient. I have a Facebook page. So remember that this is separate from my personal page. My personal page is not accessible by my patients. That is my personal account. Now, this is a professional page attached to my personal page, which patients can access. So it has here what my service is, and they can set appointments here. And if you look at the About portion, it mentions what my services are for this page, which means this is basically for general education. So I post here information as to whether my telecommunication services are open for the week, or if I'm going to be out for the week and I'm not accessible. I give here materials to give patients instructions, for example, on how to take pictures of their upper airway. So things that can be useful for general education and management, and general information that will be helpful for patients, especially with disorders of the lungs or sleep. So it has to specify what its function is for. So if you notice, I did not put in anything like my personal successes, my accomplishments, my training, because this is not allowable in terms of our PMA Code of Ethics. So there's an answer that yes, we can post, but no, we cannot promote our practice in the sense that it cannot be used for soliciting or recruiting patients. So the goal of that page is not to recruit patients per se, but to give information. If you have someone who is actively recruiting online for you, then that becomes something that is considered unethical. And it said here that we cannot post or publish personal superiority in terms of special certificates, diplomas, trainings, specific methods of treatment, as well as operative techniques, that this cannot be contained in terms of our online sites. All right. Now, do remember that whatever interactions that we make via social media is going to be potentially problematic. So it's been identified that there's at least just 4 degrees of separation between patients and any other individual, or any individual and any other person who is online. So that means if we post something about our patients online, so although the patient may be very far from us, through another physician who interacts with another patient, this information may be transmitted to that patient. So this is why it's important that when you talk about telehealth, especially when we make use of social media for our healthcare practices, we have to be mindful of what we post online. So that means we have to remember that our patients cannot be friends on our personal pages. What we post online generally stays online, and what we post, even if we delete it, may eventually be retrievable. So this information always has to be kept in place, and we have to remember always to be digital professionals, as we mentioned earlier on in this lecture. So let's now go next. So we know that we can actually indicate our practice online. We can choose to whether to practice telemedicine. Now, however, if we do choose to do so, does this actually establish a physician-patient relationship? And this will be one of the challenges. Does a phone or virtual consultation actually establish a relationship? So if you notice, the answer here is a tentative yes. That means ideally, when you talk about telemedicine, it is useful in the management of chronic conditions, or basically follow up after initial treatment where it has been proven to be safe and effective. So it's more ideal that the first consultation is actually a face-to-face consult. But we do understand the limitations, especially in this era of a pandemic, or even in the post-pandemic. So it can also be used to manage specific cases, and we'll try to focus on some of that later. But the ideal first consult will always be a face-to-face consult. Now, as we said, this can be useful for follow-up of your patients, even for patients who have been hospitalized. So these are the basic uses of telemedicine as been dictated by the Centers for Disease Control in the US. And that for COVID-19 can be used actually to screen patients. And for patients who have urgent care but are low risk and their non-COVID conditions, we can identify the patients who may need actually more medical attention. So we usually see, when I see the patient online, if they have signs of distress, I can immediately send them to the hospital, no? Because I see this online. So it's not via voice, it's not via text, but via a video consult. It will allow patients, of course, as we said, access to primary care providers, and this can be used in conditions such as mental or behavioral health or chronic health conditions. So what I've used this also very frequently in the past was in terms of helping patients in terms of like smoking cessation. So it can be used for coaching and support for patients, and as well as counseling, including nutrition. Now, another use will be in terms of monitoring conditions that are already chronic in themselves. No? So, diabetics, they can send you their blood glucose measurements, blood pressure measurements, and other remote assessments. And we'll show you some of these devices later on that can be used. And of course, it is useful for patients who have difficulties in accessing care. And this is one of the things that we have to balance. Are we potentially placing these patients at harm when we do telemedicine? But without access to healthcare, are we not placing them in greater harm's way? So we will be balancing the patients who have difficulty in accessing care so that we are able to at least provide them some form of medical assistance. Now, as I said, it can be used for hospitalization, but these are patients already with established relationships with a physician. So this is another aspect. That's why we put this in gray. So in these particular cases, you have already established also a physician-patient relationship. Other things that we've done also will be, I make use of this in terms of being asked to join family meetings in terms of deciding for advanced care planning and counseling for patients when a life-threatening event or a medical crisis occurs. And of course, we've also mentioned this, that it's usually for the low risk, but it's really non-emergent condition. So for those, especially in the US, who live in, let's say, retirement homes or long-term care facilities, this can be used as well. Now, this is not a physician-patient relationship, but do remember that telemedicine is useful for training and education in terms of peer-to-peer professional consultations that can be available. So if there is no, let's say, pulmonologist, sleep specialist in an area, a primary care practitioner or a practitioner in that area may contact me, and with the consent of the patient, we may discuss potential cases, and this gives this patient access to specialist care. What we do want to emphasize is that it is always very important to establish informed consent. Our medical legal friends will always tell us that there has to be a written consent, or at least in my case, I do a verbal recorded consent, that they consent to the actual consultation. And the consent generally contains how telemedicine works, how they schedule appointments, privacy concerns, and this is very important, that there's a possibility of technological failure. I'm sure you've all experienced somehow at one point in time disconnection. And we will talk about also confidentiality breaches. There must be protocols of contact during the visits, which we'll emphasize later on, especially for this patient of ours who presents with urethral discharge. And what are the prescribing policies and how do we coordinate care for the patient? Now, we do have to make sure that patients are aware and they understand that there are difficulties and uncertainties. Uncertainties have to be emphasized in terms of telemedicine. And we must be prepared to recommend direct patient-doctor contact when we believe it's in the patient's best interest. So we can actually establish a relationship with our patient via telemedicine, but we have to make sure we are able to recommend direct patient contact when it is needed, aside from providing them off-hours resources. And as we said, one of the things that we have to be aware of is that we are able to provide our patients information about how to use their telecommunication system, because this is the only way we have to make sure that we are able to communicate clearly with our patients via telemedicine. All right, so our next question is, this patient denies any sexual activity but has urethral discharge. So can I look through my patient's social media accounts for my history taking to see if he has probably been involved in some sexual activity as been posted online? So this is a question that was addressed to psychiatrists, that should psychiatrists Google their patients? However, they said it's bad practice because it bypasses the personal relationship with our patients. It erodes trust because we are actually doing this hidden or surreptitiously, and represents an invasion of privacy. So it is discouraged that even if your patient's accounts are available in terms of the public domain, for you to access this without the patient's knowledge or consent. However, this can be done, they say, for certain situations, like checking for conflicting or falsified information, uncovering dangerous lifestyle choices. Now, it may be also to make sure that there's no mistaken identity. For mental health, especially for those who post things about self-harm, it may be used for monitoring as well as safeguarding vulnerable patients online. However, it's been said that Googling should really be done when there's really no other option. The challenge is whether to not to ask for consent, because if they do not ask for consent, we cannot get that information. But again, trust is important. So in general, it is not advised for us to Google our patients. Okay, now this is another tricky part. Can we do an online genital examination? Can we ask our patient to show to us his genitalia online to press to see whether there's any particular discharge? Can we do this online? So basically, with a teleconsultation, we can do everything in the same way, but we have to make sure we do preparation. In this particular case, it's just like looking at a chart to prepare for a consultation, and we'll show you later on how this can be done. We do our history taking, which can be actually more extensive, and I can show you how this can be supplemented in a teleconsult. Now, a physical examination will be limited simply to inspection. We do not have here palpation, auscultation, or percussion. However, this can be taken. This advantage can be taken away if you tie up with a physician in the specific area or a healthcare work in the area who can do the examination for you and relay the findings via technology. And if you can have remote monitoring devices. But Jenny, this is one of the basic limitations of teleconsult, which is our physical exam. Patients can be given prescriptions and payments can be done via technology. So the question is, will this now be, knowing that, can this now be identified as, is this equivalent to a face-to-face consultation? So the answer here is, of course, is no. Although it has a lot of advantages also, which we'll show you in the subsequent slides. The gold standard of consultation will still be a face-to-face consultation. And our goal here is that when we deliver telemedicine services, however, it must be consistent with in-person services. And the evidence, it must be supported rather by evidence-based information as to what we do online. So let's talk about benefits. We've talked about the risks that physical examination may be insufficient. And we talk about probably being able to do a physical examination, but there are benefits, and we'll mention also some of the risks that are associated with face-to-face consultation. So one is that we can provide the patient actually online material for patient education. So remember that our visits usually in the clinic are around 17 minutes, maybe, or 30 minutes at the longest. So we cannot provide the patient complete information. And in the Philippines, they found that Filipinos spend as much as 4 hours on social media. So one of the advantages now of telemedicine is you can provide them actually information which they can access. For example, on my page, I post their information about sleep, but the information is something I've already vetted or reviewed. I look at who the provider is, what the funding comes from, what the quality of the information is, because I review the evidence, and I make sure it doesn't violate my patient's privacy. Once you've identified that, then you can post it online for your patients to make use of. So your care for the patient is extended beyond your clinic, and that you're able to give them more information and improve their health literacy. So we've talked about here something about monitoring. So we'll talk about here 2 types of telemedicine. Well, we talk about synchronous, and this is what we've been talking about, where you talk to your patient as if it were an actual consult via video. But it can also be asynchronous, where patients can email or send you materials beforehand or even after the consultation. And we now have devices which can do remote patient monitoring. We can have oximeters which connect via Bluetooth, and a lot of patients already have the cell phones which can monitor activity, as well as smart watches as well. So we can divide this into 2 parts. Either it's a store and forward. I'm sorry, there's an error here. Store and forward here. Sorry, this is store and forward, and this is real time, or what we call our video conferencing. So what we call as asynchronous, these are images. It allows us to a more flexible part in terms of our time. The problem is we may not be able to give as much attention or pay immediate attention to things that are sent to us by our patients, but it is of low cost because they will not spend for this. As we said, the delay in response is there. However, high resolution images can be set, and it's better fit in terms of our workflow for the day. Now, for what we call the synchronous consultations, these are video conferencing. So it makes use of video. It's the closest to an actual consultation that we will have. However, this is time consuming. It may be more expensive because our patients may have to spend for their internet connectivity. No? So especially if they're using data. Now, it allows for more clinical and in-depth examination, and it's immediate in terms of responses. However, the images here are lower resolution depending on the bandwidth that is available, and of course, it interferes with the daily workflow. So let's go back. Can we perform a physical examination via telemedicine? As I mentioned, it can be done via inspection. However, the others can also be done by an assistant, or this can be done via video and sent to you if the patient has low bandwidth in terms of connectivity. However, we have to make sure that the patient is identifiable to make sure we're really seeing the patient and the areas we are examining are very visible. And we have to remember that we have a responsibility, especially even if when we refer these patients to other professionals, we remain responsible for the care. Now, these are some of the things that should be ensured. But when you do an examination, there must be visual and auditory privacy. All patients in the room at both sites, whether at your site or the patient site, should be identified. There must be adequate lighting, and there must be minimized interruption. Okay? Now, you have guides on how to do a physical examination that's provided by the UP Medical Informatics Unit in terms of their guide document that was released in April 29. We also have a document in Pulmo which we released in March 15, 2020 as to how to do an examination for the pulmonary system. However, the challenge here is we have to make sure that we maintain patient confidentiality, privacy, and data integrity because they can be compromised. So that means we have to make sure that our systems are up to date in terms of security measures. So would I ask my patient to show me his genitals online? I would not. So anything that would be potentially compromising for an individual, I would not do. So that means these are things we have to avoid doing because images can be hacked. And this will be a potential problem. So this tells you now part of the limitations really of telemedicine. So as we said, although we promise our full efforts at safeguarding confidentiality and privacy, it cannot be absolutely guaranteed. So we're now almost down to the last parts. Can we prescribe via telemedicine? Can we give medications? Well, it is allowed by the FDA rules on e-prescription, especially during the pandemic. And that we have to make sure, though, that it is at the advantage of being able to provide the patient, especially a typewritten, which in my case is a computerized form, which allows has less room for misunderstanding. And you have to make sure here that's important is that the patients understood whatever advice is given to make sure that there is no misunderstanding, and you try to make sure that there is continuity care that's provided. The advantage of telemedicine is allows me to keep now a detailed record of whatever advice I give because it is done by technology and there is a recording in terms of the information that I send to the patient. And I can actually give them videos, for example, in my particular practice on how to use inhaler devices that they can look at. And it now makes sure that the patients use the medications properly. Okay, all down to the last, I think, 2 questions. Can we charge for telemedicine? Well, obviously, this is service rendered. Therefore, a fee can also be extracted. Just remember that the charging for telemedicine follows that of actual life, where the capacity of the patient to pay is the most important. Right? So we must be able to extend these services also to patients who may not be able to pay. And that's part of our goal as physicians, to be able to make sure that healthcare becomes equitable. Now, of course, you can charge depending on the difficulty of the case, maybe higher charges, standards of the community, stature, expertise, equipment and establishment of running costs, time involved, and cost of living. Obviously, here we don't have issues in terms of the locality when the practice is carried out. All right. So, last question is, can telemedicine itself be unjust? So, I think the answer here, of course, will be yes. Because, of course, patients who do not have access to technology and even older patients who are not aware of how to use it can be marginalized. So physicians must be aware that telemedicine technologies could be unaffordable to patients, and it can actually further widen the health outcomes gap between the poor and the rich. So part of our goal is to make sure that this tool becomes something that allows us to reach more patients and give them more access to our services as healthcare practitioners. So let me end with this. That it's been said that from the Hastings Centers that telemedicine needs ethical guidelines. It is to help define what is the professional conduct in terms of our relationships, how do we maintain patient privacy and safety, and of course, to make sure that the human values of relationships are maintained despite this being done over technology. We have to involve our patients and protect their autonomy. And at the end of the day, we have to weigh the benefits and know the harms that can be brought about by the use of teleconsultation. Right? So going back to our patient, Teleconsults are a new tool that gives our patients wider access to healthcare and allows us to reach more patients. But in the process, we have to understand our patients' autonomy, where informed consent is necessary for them to be able to participate. And we have to have the responsibility of knowing and developing our skills before we embark on participating in teleconsults. It must be done for the benefit of our patients and hopefully the Filipino population, and we have to do our best to avoid any form of harm that may occur. And at the end of the day, this has to be a service that is just and that offers healthcare to every Filipino in our nation. So with that, I'd like to thank everyone for your kind attention, and I do hope you picked up something new for this morning. So again, my thanks to the Philippine Urological Association Mindanao chapter and to everyone for their kind attention.